Mental health is a serious challenge within our communities we live in. These issues are more serious more than one can imagine. There are many common causes of mental health issues. Some of the causes of the mental health are a combination of genetic, biological, and environment factors, such as brain, chemistry, and a family history of mental illness. Life experience including trauma, chronic stress, and early adverse experience like abuse, stigma, drug abuse such as alcohol, and many other factors. Zambia today joined the rest of the world in commemorating the World Mental Health Day under the theme Access to Services, Mental Health in Catastrophes and Emergencies. Health Minister Dr. Elijah Muchima, who was represented by the Ministry of Health's Director for Public Health, Dr. Matilda Simpungwe, said, 10th of October marks an important occasion when all countries globally reaffirms their commitment to ameliorating the negative effects of mental illness amongst their people by increasing investment in mental health services provision and making mental health a universal human right.
The negative effects of mental illnesses among their people by increasing investment in mental health service provision and making mental health a universal human right. The theme for this year is highly opportune and aligned with the current global situation. The world faces countless catastrophes and emergencies, including our country, Zambia.
Dr. Muchima highlighted that over the years, millions of people have been affected by natural disasters such as floods, diseases outbreaks such as cholera, droughts, road traffic accidents, infernos, mine accidents, and many others, which have disrupted families, livelihood, and essential services, thereby significantly impacted mental health. He noted that nearly all those affected experience some form of psychological distress, while a minority will go on to develop mental health conditions such as depression or post-traumatic stress disorder. Dr. Muchima recommended the full utilization of the international guidelines on mental health psychosocial support to effectively prepare and respond to emergencies,
which has its own share of these problems. Ladies and gentlemen, we should be aware and be reminded that almost all people affected by emergencies experience psychological distress, which typically improves over time. 1 in 5 people who have experienced catastrophic events and emergencies in the previous 10 years suffer from either depression or anxiety or post-traumatic stress disorder or bipolar disorders or schizophrenia. Catastrophes and emergencies equally disrupt health services, including mental health, and also limit access to quality care. This predisposes persons with severe mental health conditions to further vulnerability in that access is compromised. Over the years, millions of our people have been affected by natural disasters such as floods, disease outbreaks such as cholera, droughts, road traffic accidents, infernos, mine accidents, and many others. These crises disrupt families, livelihoods, and essential services, and significantly impact mental health. Nearly all these affected experience some form of psychological distress. Nearly all those affected experience some form of psychological distress. A minority will go on to develop mental health conditions such as depression or post-traumatic distress disorder. Emergencies, therefore, can worsen mental health conditions and predispose our people to social issues such as poverty and discrimination. Some of the common challenges after a disaster will include anxiety, distress, illness, death, and grief. Others are loss of income, child care struggles, family separations, and substance abuse. Ladies and gentlemen, in order to counter catastrophes and emergencies, which sometimes are natural, there is a need to prepare and mobilize support, healing, and care for those affected. We need to establish pathways to provide mental health and psychological and social support during emergencies, which would range from community self-help and communication to psychological first aid and clinical mental health care. The inclusion of mental health services in our disaster risk reduction and response package is essential. As Ministry of Health, we want to use emergency response declarations as an opportunity to invest in mental health, leveraging the increased aid and attention we receive to develop better care systems for the long term. I therefore recommend the following actions. Number one, utilize fully the international guidelines on mental health, psychosocial support to effectively prepare and respond to emergencies. Number two, include mental health and psychosocial support in all sectoral assessments, capacity building plans, coordination mechanisms, and contingency plans. Number three, establish a cross-sectoral mental health and psychosocial support technical working group to coordinate activities in line with the global guidelines. Number four, strengthen community self-help and social support, ensuring the involvement of vulnerable people, including people with mental health conditions. Number five, continue orienting frontline workers in psychological first aid to provide emotional support to people experiencing acute distress. Number six, share key messages and service information to encourage positive coping and help seeking. Number seven, offer clinical mental health care for priority conditions at general health facilities using trained and supervised staff and evidence-based protocols. Number eight, protect and promote the rights of people with severe mental health conditions, including those living in institutions such as psychiatric hospitals, social care homes, and rehabilitation clinics for substance use. And lastly, number nine, establish referral networks between mental health specialists, general health care providers, community supporters, and other relevant service providers, be it in schools, social welfare, or emergency relief.
The Ministry of Health commemorated the World Mental Health Day under the theme Access to Service, Mental Health in Catastrophes and Emergencies in Lusaka, Kanyama area. Maria Abishai, Street TV Zambia. Thanks for watching and God bless you.
It's time to register. The Electoral Commission of Zambia will be conducting mass voter registration across the country from the 13th of October to the 11th of November 2025. If you are 18 years and above, a Zambian citizen and in possession of a Green National Registration Card, NRC, you qualify to register. If you registered in 2020 or during continuous registration of voters and you still have your voter's card, you don't need to register again. During this registration period, ECZ will be providing the following services: new registrations, replacement of lost, destroyed or defaced voters' cards, transfers from one polling station to another, claims for omission on the register of voters, corrections of clerical errors, and removal of deceased voters. Registration centers will be open throughout the week from 8 hours to 17 hours. Register now. It's your right. It's your choice. This message is brought to you by the Electoral Commission of Zambia.